Good evening. Greetings from Geneva, the Department of Sexual and Reproductive Health, and HRP, the WHO, UNICEF, UNFPA, UNDP, and World Bank co-sponsored special research program. I sincerely apologize for not being able to join you during the springtime reception. Spring symbolizes renewal, heralding new life and joyful beginnings. However, as Dr. Tedros just mentioned, and many of you are aware, healthy beginnings are not a universal reality. Women continue to die due to pregnancy-related complications. And this tragedy can strike anywhere. Collectively, you may also have professional or personal knowledge of this. We know that over 90% of maternal deaths occur in low and lower middle income countries, often in humanitarian emergencies and fragile settings. Although only a quarter of these births occur in these contexts, maternal deaths account for more than 60% of the global total. Girls in these settings face a much higher chance of dying from childbirth, over 10 times higher than other girls growing up elsewhere. In today's global landscape, fragility is much closer than we might think. Targeted interventions are crucial for significantly reducing maternal and newborn deaths everywhere. Why do our mothers die? As an obstetrician, I've had the difficult task of documenting the causes of death: bleeding, infection, untreated high blood pressure, eclampsia. But this clinical perspective doesn't capture the full picture. Women are dying because they lack access to prenatal care, skilled providers, and quality-assured medications. Can you imagine the tragedy of treating preeclampsia with falsified magnesium sulfate, a cheap medication, and yet up to 40% of samples tested in low and middle income countries are substandard? How can you treat anybody with this? When women experience complications, their babies suffer too. Nearly half of all children who die before age 5 are newborns. We know that all babies need essential care at birth and in their first month. This includes breastfeeding, protection from infections, warmth, and nourishment. Clearly, this is much more difficult if your mother is not present, and premature babies are especially vulnerable. The crisis of maternal and newborn deaths is just the tip of the iceberg. Beneath it lies all the challenging social issues, inequities in healthcare access, education, and gender rights. Simply, many women don't receive the care they need in time or at all. To improve maternal health, we must address the barriers to quality sexual and reproductive health services at both the health system and societal levels. Let me be clear. The focus cannot be limited to the time of pregnancy. Some women have chronic conditions before pregnancy, and we need to optimize their health before and during pregnancy. After childbirth, around a third of women will suffer long-term health complications. For instance, new mothers may experience postpartum depression or anxiety, which should be addressed immediately. We need to develop a long-term integrated approach to postnatal care that connects physical health, mental health, and social support services. This is critical whether or not she wishes to have another child. Undertaking pregnancy when desired is fundamental, and yet most pregnancies remain to be unplanned, and approximately 256 women in low and middle income countries have an unmet need for modern contraception. Addressing this need can significantly reduce unintended pregnancies and their related risks. We live in tumultuous times, and it may be easier to ignore problems that seem really distant. But every 2 minutes, a woman dies from preventable pregnancy and childbirth causes. This affects families, communities, and all of us. WHO calls for a worldwide reinvigoration of efforts to ensure high-quality care for women and babies. In our maternal perinatal health team, we will continue to do our part in developing new knowledge for equitable access to innovative solutions to address global maternal and newborn health priorities and to ensure the healthy lives and well-being for all women and their babies. The question is not whether or not we can end preventable maternal and newborn deaths, but whether we will choose to. During this reception, I ask you to consider your choice and how you can support new beginnings. I thank you.